Finding what looks like a whole metformin pill in your stool can definitely be worrying. But here's the thing, this is actually a normal part of how extended release metformin works, and I'm going to explain exactly why this happens. Let me walk you through what's going on. Extended release metformin uses special tablet designs that control how the medication gets released in your body. These tablets have outer shells or matrices made from materials your body can't digest, like cellulose polymers and other pharmaceutical ingredients. As the tablet moves through your digestive system, the active metformin slowly dissolves and gets absorbed through your intestinal wall. But that outer shell, it stays intact. It's designed that way. So what you're seeing in your stool is usually just an empty shell. The medication itself has already been absorbed. There are several types of these delivery systems: hydrophilic matrix systems like glucophage, XR, osmotic pump systems like Fortamit, and gastric retentive technologies used in some products. All of these are FDA-approved technologies, and they can all leave behind tablet remnants that look like whole pills. The FDA labeling for several extended-release metformin products actually mentions this. They note that patients may occasionally see tablet shells in their stool and that this is expected. It doesn't mean the medication isn't working. Now, immediate-release metformin is different. Those tablets typically dissolve completely. You're less likely to see anything in your stool with that formulation. So how do you know if your metformin is actually working? The answer isn't about what you see in the toilet. It's about your blood sugar control. Your healthcare provider will monitor your A1C levels and your glucose readings. Those measurements tell the real story about whether your medication is effective. If you're seeing tablet shells but your blood sugar is well controlled, that's a good sign the medication is doing its job. The shell passed through, but the medicine got absorbed along the way. Here's what you should discuss with your healthcare provider. If you're concerned about seeing tablets in your stool, bring it up at your next appointment. They can confirm whether you're on an extended release formulation and whether this is expected. If you're unsure which formulation you have, you can also check your prescription label or ask your pharmacist. Talk to them about your blood sugar patterns. Are your glucose levels staying in your target range? Has your A1C improved or stayed stable? These are the important questions. And if you're having trouble swallowing the tablets or you're experiencing digestive issues, mention that too. Your doctor might have suggestions or could consider adjusting your treatment plan. One really important thing to remember: never crush, chew, or split extended release metformin tablets. Doing this destroys the controlled release mechanism. It can cause the entire dose to be released at once, which may lead to adverse effects or reduced effectiveness. Always take your medication exactly as prescribed by your doctor, and don't change or stop your medication without talking to your healthcare professional. Now, when should you actually contact your healthcare provider? If you're seeing what look like intact tablets and your blood sugar control is getting worse, that's worth a call. If you notice new or worsening gastrointestinal symptoms along with the tablet shells, reach out. And if you have any concerns about whether your medication is being absorbed properly, don't hesitate to ask. Also, certain digestive conditions or very rapid transit time through your intestines could potentially affect medication absorption. If you have ongoing digestive issues, that's something to discuss with your doctor. Let me recap the key points. Seeing what looks like a whole metformin pill in your stool is usually normal with extended release formulations. It's typically just an empty shell. The medication itself has already been absorbed. Your blood sugar control, not what you see in your stool, is the real measure of whether your medication is working. If you found this helpful, drop a comment below and let me know what topics you'd like us to cover next. And don't forget to like and subscribe for more evidence-based health information. Remember, this information is educational and not a substitute for personalized medical advice. Always consult with your healthcare professional about your specific situation and treatment plan.